Thanks. I was just saying, I have 18-year-old twins, and between caregiving and fertility issues, I think these are like just universal issues that everybody has. I also believe that sonograms were invented for men, because until we could see it on TV, we didn't have a clue. And let me tell you, when they tell you you have twins, your reaction is change the channel. Now you can't imagine life without them. Okay, so Health Innovation Frontiers is the third version of a study that we did starting in 2013. And it was the result of a campaign that we had with the venture community and the entrepreneurial community to address a single question. And the question is, what's your 50-plus strategy? Right? We're talking about a population of over 100 million people. You have a situation where the narrative in Washington is basically we can't afford all these old people, which is fascinating because it's only in Washington where serving the needs of over 100 million people is called an unaffordable cost and financial burden. In the private sector, we assumed serving the needs of over 100 million people represented opportunity, and that was the lens through which it was discussed. So we would go out and we had a very sledgehammer message, which was you'd have to be an idiot to turn your back on the only humongous growth market that exists. And after a little while, different VCs, different entrepreneurs, industry would come to us and say, okay, Holtzman, shut up, big numbers, blah, blah, blah. But now where should we focus? You're asking us to invest, you're asking us to take attention away from things that we're doing, but where's the opportunity? How big is that opportunity? Can we expect returns on our investment that we would get from other verticals? And so for AARP, the small nonprofit that I work for, our reaction was, this is fabulous, because the market is telling us the role that we need you to play is to help fill these information gaps. And that led us to Health Innovation Frontiers. So the paradigm for this was that it's not just about products and services targeted at the 50-plus, but it's also about products and services equally relevant to the 50-plus. And one of the messages on the design side is that things need to be designed for all, right? Little black things with black buttons in a 2-point font, not good for somebody over 50, not good for somebody under 50. So, curb cuts, originally for ADA and wheelchairs, also really good for strollers and young parents. So that was part of the message. So what have we seen? Well, first of all, this is a huge market with great revenue potential. The last version of the report, we forecast a $30 billion revenue opportunity in new innovative products and services in digital health of relevance to people over 50. In our latest update, that's gone up $4 billion. The more interesting thing, though, is where is the growth coming from? And it's coming from almost completely the innovative side of the equation, right? It's, the traditional businesses and services are basically we see as flat, but we see 25% growth and, more importantly, just a growing share of revenue being represented by these companies, rising from 20% of total revenue in 2015, rising to 42% in 2020. So what are we seeing where the action is? What are the trends that we're seeing? Well, we're seeing that smart sensors are just getting better and better, and the algorithms and the tech and the thinking and the whole construct of the Internet of Things. And for anybody taking pictures, feel free to do so. You can also download this for free. And there's there's both the full report that was done for us by Parks Associates, there's an infographic, and there's a much larger version of this slide deck. that I'm presenting. Anybody come up to me later, and I'll be happy to share the URL with you. Smart sensors and connected devices. We're seeing momentum in terms of on-demand care. I think Uber has kind of just created this notion of there's the Uber of everything. And so, for example, caregiving, and a company like Honor is out there with a promise that after you get a discharge from a hospital, they will get you a caregiver within 2 hours, right? So there's just a new orientation, and the technology underlying it is really the key. The spread of platform as a business, companies like Validic that are creating those platforms, laying out clearly how other players can work with them on the platform, and then making sense of all that data that comes through for the array of players, providers, et cetera, in the health ecosystem. And then reimbursement as a revenue model. When we first got started with this, we would hear, the response was always, well, who's going to pay for that? And really that was code for saying, I'm not going to take the risk until I know Medicare and or other payers are gonna reimburse. And our initial response to this was, nobody reimburses in the multi-billion-dollar vitamin market and supplements market. When people see value, they'll put their hands in their pockets and they'll spend money. But what we've also begun to see is that startup companies have embraced the need for data and proof of concept and of the efficacy of their products and services, and as a result, Medicare, CMS, providers, payers are starting to reimburse. So telehealth was really one of the first areas where we started to see reimbursement, but it was initially limited to mental health, right? Now, more recently, we see a company like Omada Health, because they had the data and could make the case, getting reimbursed for diabetes management. So just as a lesson, right, playing that card, understanding the importance of data, and having this as another potential for revenue is increasingly becoming important, but more importantly, it's increasingly becoming possible. So out with the old, in with the new. We're going from chronic disease treatment, I'm sure this isn't particularly new for the audience, to preventive care, from siloed to integrated platforms, paying for care navigation, medication management out of pocket, to starting to see reimbursement for medication management, uncoordinated care to being very personalized and connected. Traditional medical alerts, really now it's all-purpose safety monitoring. Free diet and nutrition apps to now freemium diet and nutrition services like Zapongo. Ad-funded behavioral health solutions to fee-funded behavioral solutions. The report just goes into this in great detail. So I'll really leave it to you. So where's the growth? Where's the opportunity? When we first started this out, initially we started, well, it should be just focused on for the 50 plus. But we realized that actually has the negative connotation of not recognizing that people over 50 and older live life like anybody else. And there's a whole slew of things that people over 50 do that are not limited by age. Life is life, it's complex. People got things in the morning that they need to do, and they got things that they want to do, and that's irrespective of age. And then there are particular things that are, in fact, age specific. But these are the 9 areas that we see. Medication management, pretty obvious. Smart aging are around things like brain fitness, vision, and hearing. New care delivery is all about the array of ways that telehealth and other tech-enabled care delivery models are happening. And we're also seeing back to the future, with things like, home visits. When I was a kid, you got sick, the doctor came to your house. Then all of a sudden, at some point, it became common wisdom that if you had 105 fever, it was 10 degrees outside, you should bundle up and go outside and go sit in a waiting room with other people to share germs for the convenience of the doctor. Recently, MedStar Health in the mid-Atlantic states did a study of the oldest and frailest Medicare recipients, who are also the most expensive Medicare recipients. And they compared the current delivery model with a home visit model based around a doc, a social worker, and an RN or a nurse practitioner in some sequenced way. And the comparative cost was a 17% cost savings with a home visit. You would think with that additional resource expenditure that would be the more expensive model. But no. And why? Like with everything else in reducing costs in the healthcare system, it was about keeping people out of the hospital, right? The problem is CMS doesn't reimburse for home visits. So that's really the obstacle for folks like us and you guys to start demanding changes about. Care guidance, care coordination. It's not just, how do you get out of the hospital and then who's going to help you, but it's also things like all of the billing and things that come at you, and how do you manage that in this time of stress? Companies like CoPatient, a couple of great entrepreneurs out of Athena Health addressing that. Safe living, physical fitness. Again, these are things equally relevant to people over 50 as they are for the population at large. Diet and nutrition, social engagement. The issue of isolation is one of the most essential, one of the most important areas of prevention, right? If you can prevent somebody from feeling isolated, isolation leads to depression, depression leads to a whole slew of medical problems, and just leads directly to the hospital. And then behavioral health. We're finally starting to get a handle on methodologies that actually do help people develop new muscle memory, a new autopilot, the automatic response to whatever the issue is, whether it's diet or whether it's physical activity, whatever those approaches are. And the benefit of all of this is that it really comes down to diet and physical activity. And when those things are right, they have benefits across a whole slew of health spectrums, including, as you get older, things like dementia and Alzheimer's as preventative measures. So when we look at where the opportunity for innovation is, increasingly it's going to be responsible in our forecast for huge percentages of each of these categories, most largely in medication management, 80%, and then 50%. But large proportions are coming from the innovation side. And the numbers are big. I always believe that numbers that end in B or T should get your attention. These are all B numbers in the billions. Medication management, our forecast is that over the 6 years, 2015 to 2020, that's a $1.5 billion market. We've got a $3.6 billion market for care guidance, et cetera. You can read the slides. So all of this is happening at a time that is concurrent with a demographic wave that is going to increase the number of older people in this country considerably. And if we're not on top of these things, if we're not acknowledging that there is huge opportunity and that the orientation of the conversation has to be through the opportunity lens, then we're going to have, just even bigger problems than the naysayers believe we will. And with that, I would just leave you with this question. What's your 50 plus strategy? Thank you.